Meet Dr. Hankins, a Dignity Health provider specializing in orthopedic surgery. Meet Sabrina, a 65-year-old female who has been managing her arthritic knees with Dr. Hankins for over 10 years. With worsening symptoms, Dr. Hankins orders Sabrina to take updated x-rays at a nearby imaging facility. Sabrina gets x-rayed and Dr. Hankins receives her images along with her radiology report and sends Sabrina a message asking her to schedule a follow-up visit. When Sabrina returns from her follow-up, Dr. Hankins pulls up prior scans side by side on his iPad to show her how her arthritis has progressed and how her knee compares to a normal knee. Sabrina voice annotates her images as Dr. Hankins is speaking so that she doesn't miss a thing. Dr. Hankins schedules Sabrina for surgery to undergo a total arthroplasty of the affected joint at a hospital nearby her home and sends Sabrina a calendar invite. The invitation includes the hospital's address, the phone number of the registration staff, hours of operation, and the location of surgery ward she will be staying in. Sabrina needs to have some lab work done, so the admin uploads preoperative testing instructions, lab locations and hours, medical forms, consent forms for Sabrina to sign, as well as pre-surgery prep instructions, all in the JACC Imaging platform. They also include links to arthritis-related online resources and support groups. Dr. Hankins also puts in an order for a 3D print of Sabrina's damaged knee joint to fit the exact size and shape of his patient. It is ordered to be delivered to the hospital in time for surgical prep. That night, Sabrina reviews all of her materials on the JACC Imaging platform. She signs the consent forms and schedules her lab work for the very next day. She opens her annotated x-rays and shares these, along with Dr. Hankins and her radiologist reports, with her daughter-in-law, an orthopedic resident on the other side of the world in Japan. Sabrina falls asleep while reviewing and highlighting her pre-surgery preparation instructions. A week later, Sabrina checks into the hospital for her surgery. Her nurse adds content stored on Box to Sabrina's JACC Imaging case, which Sabrina reviews and takes notes on. Admin also includes contact information for each member of Sabrina's care team, which Sabrina adds at the bottom of her case. The view tracker on Sabrina's pre-operation instructions show that Sabrina opened the pre-surgery prep instructions but did not get through to the last page. Sabrina completes the final page before she undergoes her surgery with no complications. At discharge, Sabrina's son picks her up. Sabrina shares her entire medical record with her son, who opens it up on his iPad and follows the guidelines on the post-op Safe Home Environment Setup report to help his mom avoid injury. He gets a notification that the physical therapist has uploaded new exercise videos and plays a video for his mom. After a few weeks, Sabrina is anxious to get back to her regular activities, including gardening. She secure messages both her physical therapist and Dr. Hankins asking whether they think her knees are ready. She shares her entire patient record once again, including images, lab results, and reports with her physical therapist, who schedules a follow-up visit for later that week.